back and we're talking COVID-19 numbers today. 545 new cases confirmed by DHEC with 4 additional deaths, and that percent positive of yesterday's test results, 11%. And the 7-day moving average percent positive, it's back up now at 14.3%. This is one of the highest rates in the Southeast.
And right now we have Prisma Health nurse Jenn Turner joining us live. She's the Vice President of the Nurse Executive, Ambulatory and Virtual Care there. Thanks so much for joining us, Ms. Turner. And we'll start out with this one. Are hospitalizations due to COVID going down, going up? What are you seeing right now here in the upstate?
Yeah, right now they're definitely decreasing as a whole, nowhere near our numbers we were seeing back in July and August when things were at our peak. But that's not to say that we aren't still seeing cases, definitely still seeing brand new cases every day and still seeing deaths from COVID, unfortunately. But our overall hospital rate is still down right now.
And what have doctors and nurses like you learned about treating COVID-19? There's so much that we still don't know.
Right, it's a brand new disease and we learn new things every day. I will say that we have a great team of experts here that, of course, investigates everything that comes out, trying to, look at our recommendations from our other states and countries that have experienced this disease, looking at our CDC and DHEC partners to figure out, what works best. And again, we're learning something new every single day.
And what about testing? I know for a while we were seeing a lot of testing sites, very busy. Are you guys seeing people testing less now? Is it kind of went up? What are you guys seeing as far as a trend here?
Yeah, it kind of varies right now. Over the last probably month or so, we've seen a big decrease in testing, about 50% decrease in numbers from where we were, a couple months ago. But I will say over the last few days, the testing numbers are starting to come back up. So, you never know. It varies with what's going on in the environment.
And we're curious, will Prisma get any of those rapid COVID tests for the general public, or will those tests be used again for the healthcare workers, frontline workers, people who need it first?
Well, there are lots of companies out there looking at tests now, and so I'll tell you, our team of lab experts identifies and investigates every single test that comes out, looks to make sure they're reliable and accurate, and once we know for sure that those are as reliable as we need them to be to give good, solid, accurate test results, then we'll add them to our repertoire of testing that we do. But it really varies on how much we can prove that those are going to be accurate and get good, accurate results.
And today we're hearing that if you tested positive for COVID-19, you have to wait to get a flu shot. Is that true? And why do you have to wait to get this flu shot? Of course, I know people are recommending getting one now.
Yeah, a couple things. So the CDC recommended that people who have tested positive for COVID wait to get a flu shot, and also our team of infectious disease doctors here also recommend that. At Prisma Health, we are recommending that you wait 20 days after a positive diagnosis, and really it's just we're trying to protect everyone, keep everyone safe, keep our healthcare workers safe. We don't want to have increased exposures to COVID if we don't have to, and so all of it is about protecting the patient and everyone else.
And a question we continue to get, how will flu symptoms differ from COVID symptoms?
That's a tough one, and one that we wish we could figure out. Unfortunately, the flu, COVID, allergies, cold symptoms, they're all pretty much the same. All of the symptoms overlap each other, and there's really no definitive way to tell which one you have without a test. And that's why it's so important right now to get your flu shot. That's one respiratory virus that is out there that we know how to treat and prevent, and so we are very much having a full campaign this year of everyone get your flu shot, get it early, and try and help at least a flu epidemic on top of our already COVID pandemic.
And with what's happened since Friday, we've seen our own president now test positive for COVID. I think a lot of people now, a little bit more on edge, knowing that if the president can get it, anyone can get it now in this country. And when do people really need to go see a doctor? Because again, as you mentioned, you don't really know if maybe you are getting the flu or if it's COVID. So What are you guys at Prisma telling folks if they do start to feel sick? Is it just come in right away and get tested immediately?
Well, absolutely, you need to contact your primary care physician who can help guide you through this. Again, there are so many different, flu and COVID and all other things circulating that you really need that primary care physician to help guide you through it. But we have, if you don't feel comfortable coming in to see your physician, we have telehealth ways to set up and other out-of-the-box ways for you to connect with a physician to help guide your care. If you are concerned about a COVID exposure, of course, we have our COVID drive-through lines available to get COVID testing, as well as community testing available if you are concerned that you have been exposed to COVID.
All right, and Ms. Turner, we're out of time, but just real fast, have you guys seen the flu yet here in the upstate?
We have not, and actually looking at DHEC numbers today, we've only seen one in South Carolina, which is great. So hopefully everyone's doing a great job of washing their hands and masking and social distancing, and that's only going to help with preventing the flu as well as COVID spread.
All right, thanks so much, some really good information.